Hello, dear colleagues. I'm Rodrigo Reis. I'm a dentist, and I'm here with my good fellow, Dr. Marcelo Alves, and we're gonna speak or debate a little bit here about dental bleaching, tooth whitening for FGM company, addressing some answers that were brought to our attention. Hello, Marcelo.
Hello, Rodrigo. Hello, my friends. It's a great pleasure to be here with you all. And well, let's go for it. Let's talk a little bit about dental bleaching.
Okay, the first question that came across was how long do you leave the whitening agent on top of the teeth, and how many sessions can you do? This is a question regarding office bleach, I assume.
Yeah. Well, it depends on your protocol that you use on your dental office. But if we're talking only about in-office bleaching, we might say that if you're using HP Max, which is a hydrogen peroxide 35%, you have to use it for 3 sections of 15 minutes, and you can use for 3 times, three
Clinical sessions.
clinical sections. Thank you.
3 appointments.
Yeah, 3 appointments. That was the word I was looking for. For us, it's kind of a little bit difficult, but we'll be there. If we use for 3 sections or 3 appointments, in each appointment we use 3 times for 15 minutes, because we need to control the pH of this product. If we using HP Blue, which we use in 2 syringes, and we mix them, we can apply it for 45 minutes. We don't need to change it, and we can use also for 3 appointments.
That's the average.
Yeah.
Let's expand this question. If you're doing which is more common, the mouth guard tray bleaching, the home bleach, how many weeks? So what's the time frame usually do you apply in your treatments?
It depends on the case. We really have to examine the patient and see why the tooth is dark and what kind of pigments we have there. We can use on the average from 21, 28 until 35 days of carbamide peroxide on 10% or 16%. But this is the average, 21 to 35 days.
Usually the average of 3 weeks you should be done in most cases, I believe. In cases where you have a gingival retraction, non-carious cervical lesion, what are the issues that you see? Because you might not want to apply the bleaching gel to the cervical area due to risks of sensitivity. How do you manage this? What would be your recommendations?
Non-carious cervical lesions, it's a disease. We have a professor here in Brazil, Dr. Paulo Vinicius Soares, who just finished his postdoc in the University of Chicago, and he wrote a book about this subject. Also a book in English that was
with Dr. Grippo,
with Dr. Grippo, and was presented on the last year during the IDS. And we really are concerned about it. So what we have to think about it in despite of bleaching, in concern of bleaching. Well, if we have sensitivity, we have to treat sensitivity first. And there are many ways of doing it. And after that, we need to protect this area for safety. If we do not protect it, the patient will feel the pain, for sure, and this patient won't continue this treatment with us. So that's why we have to do a very, very precise diagnosis on what's happening over there on this area to have all the prognostics, all the ways of treatment well controlled by us. So if we talk about cervical lesions, we need always to protect or before to treat the sensitivity.
Yeah, I usually trim the tray short of the cervical lesion and instruct the patient to be careful. Any excess that comes out of the tray, immediately remove out of that way. And after the treatment is done, if the yellowish of the cervical lesion is an issue, we can do composites. We might, depending on the type of retraction, if there's an interest combined with a periodontist to do some type of plastic surgery. So many ways of that. So we treat sensitivity beforehand, and then later on we manage the aesthetic issue of a yellowish cervical area.
The temporary restoration can be done with a glass ionomer, GICs.
Yes. So I guess that covered pretty much this question. Do you utilize a light source, power LEDs, laser LEDs for your office bleach?
No, not at all. Not at all. And this is something that was used in the past. There is a chemical law called Arrhenius law that says that every chemical reaction is accelerated in the presence of heat. So when they described this technique, thinking that if we could get this temperature a little bit higher, the hydrogen peroxide would work better or would work faster. But the tooth won't work as this chemical law. How can I get it more specific for you? The tooth might be clear, but will be dehydrated. When we have this humidity back to the tooth will come back to the color that was initiated.
You'll have a rebound, yeah.
Yes. So that's why we do not use the light. The light could bring damages to the tooth and
pulp inflammation, sensitivity. And the literature shows no gain on treatment efficacy using light. On the hemi-arch studies, you see no difference in color where the light was applied or not, but more sensitivity on the side.
Many people think that's marketing.
Yeah.
But dental offices need different kinds of marketing than only using light source.
And again, for those patients that approach us saying that they want laser bleach because they've seen it, what we do is we show
your cases.
Literature, show cases, and say that's not necessary. So they will believe once they see evidence. Okay, if a patient has composite restorations previously on teeth, medium to small, of course, that will be indication for bleaching, and you want to bleach those teeth, how do you manage these cases?
Well, we can do the bleaching without any concern. With the technique that you used to, and we have to tell the patient that after 7 to 10 days after we finish this bleaching treatment, we will exchange these restorations and do other restorations or work with composites all over the veneers, and then we will have good results. But we can do this bleaching without a problem, without any concern.
Once the margins are intact, are okay, you might just need in the future to replace those restorations or reduce them, refurbish them, or in case of large restorations, again, veneers might be an option, and you're just bleaching to get a more favorable substrate, right?
Yeah, sure.